What are the barriers? Why don't people get the risk-based care they need? Well, one of the main things is obviously lack of capacity. A lot of the pediatric centers would like to follow adults, but either because of space limitations or funding limitations, they can't. And as a result, most go to family doctors if they see anyone at all. As I said before, primary care physicians are usually unfamiliar with the population, and there's fairly poor communication between cancer centers and primary care physicians. I'm certainly not advocating that all survivors should be seen in a cancer center. What I am advocating for is that if you go and you're seen by a family doctor, the cancer center is responsible for making sure the information that family doctor needs to care for you properly is somehow communicated to them, whether in writing or in digital format or whatever it is. There can't be this total disconnect. And there really needs to be an opportunity, if you develop a new late effect or a challenging late effect, for that family doctor to be able to use a cancer center as a resource to say, you know, I have the survivor, they're 20 years out, suddenly they've got X, Y, or Z, and I'm not sure what to do. And to have that back and forth communication. And that's what we need to be working on. There's also survivor-related factors. So I mentioned earlier, a lot of survivors feel invulnerable to late effects. You're 18 or 17, you had ALL, you feel great, your disease is in remission, it's been so for many years, you have no long-term effects that you know of, and someone says, well, you really need to be getting risk-based care on an annual basis, and you think to yourself, but I'm fine, why do I need to do that? And as a result, many survivors do not get the regular medical care that they should be getting. Part of it is that people are not aware of their potential late effects and future risks, and I'm going to show you something in a moment that illustrates that quite nicely. A lot of people don't know the treatment they received, and I would say, interestingly, in our late effects clinic, we have the occasional survivor who doesn't know that they had cancer. So they'll show up and say, do you know why you've been transferred to our clinic? And they're now 15 or 16, and they'll say, no, not really. And we'll say, do you know that you had a rhabdomyosarcoma when you were 2? And the parent will gulp, and you'll realize that the discussion has never taken place. Well, it's very hard as a survivor to take control of your own sort of medical care and medical future when you've never been told you had cancer. So we've got to be teaching the survivors the details of their disease. Loss to follow-up in adult years is a problem. People move away, they switch towns, they decide they don't need care anymore. And other factors, economic. When you've got cancer, your family puts their life on hold. They'll give up anything to make sure you get the appropriate care. But 5, 10, 15 years later, it's tough to miss work to go down and get your annual checkup wherever you're getting it, or travel costs, or someone needs to look after the kids. So those sorts of things become barriers to getting regular care from a provider who's knowledgeable about your risks.